As India battles the coronavirus, there is a spike in demand for oxygen concentrators. The US-India Friendship Alliance is also trying to send 100,000 oxygen concentrators to India. China is the biggest manufacturer of medical equipment. But on India Today, we will show you how China is profiting from this pandemic. Sudden hike in cost of equipment, that's one part of the story. In some cases, they've doubled the prices, and in some instances, tripled the prices of equipment being sent to India. But to make matters worse, there is a sharp fall in the quality of products that is being sent. India Today's Foreign Affairs editor, Geeta Mohan, brings you this India Today exclusive report.
As India grapples with a deadly pandemic, China tries to profit from it. Take a look at these images. This is a medical-grade oxygen concentrator imported from China before the outbreak of the second wave. The images clearly reveal that medical-grade components, including compressors, have been used in the oxygen concentrators. But in the second wave, there was a sharp rise in the cases, and subsequent demand for oxygen concentrators also increased. Look at these images. The new oxygen concentrators being dispatched from China have home-grade components of poor quality.
Orders they had booked in April to be delivered just after Labour holidays, they cancelled and did not deliver, because just after Labour holidays they were able to sell the concentrators at a higher price than what the orders value that they took in April.
To make matters worse, Chinese firms have in some cases doubled the price of the equipment and in some cases increased the price 3 times. To add insult to injury, Chinese firms stand accused of arbitrarily cancelling existing contracts and then asking twice, and at times 3 times the price for renegotiating the same cancelled contract. All this when the Chinese ambassador to India claims that Chinese firms and companies are working overtime to send supplies to India. Chinese officials tried to give the impression that humanitarian aid was coming from China, but was actually substandard equipment at much higher rates. The US-India Strategic Partnership Forum alone has pledged 1 lakh oxygen concentrators to India as part of COVID relief assistance. Majority of the equipment is being sourced from China, but the spike in demand has not only driven up the prices, but has also resulted in low-end quality equipment being exported. India has protested the surge pricing and asked China to ensure steady and timely delivery. A big worry for India, apart from the surge pricing, is the quality of material being sent, which in case of medical equipment poses a serious threat to the lives of the patients.
It is a matter of life and death, and China is choosing to make profits at the cost of people's lives. Chinese companies have not only indulged in surge pricing, now they're sending substandard quality of critical COVID supplies to India. In New Delhi, Geeta Mohan for India Today.
China is yet to come clean on the origin of the virus, and now this blatant attempt to profit from the pandemic. Joining me on India First is Professor Brahma Chilani, one of India's best voices on China. Dr. Ravi Malik is the chairman and managing director of the Radix Hospital. He'll talk about why substandard equipment is playing with lives of patients. Inar Tangen is a political commentator who joins us from Beijing. My first question is to India Today's Foreign Affairs editor, Geeta Mohan. Geeta, it's not just the price that's a cause for concern. May have been doubled in some cases and tripled in others. It's the drop in quality from medical grade equipment to substandard equipment that's a cause for very serious concern.
Well, that's right. That's the biggest worry, given that because of the increase in demand, there are certain components that are not available. And if they're not available, then the manufacturers should make that very clear and should show what exactly the changes are in the new concentrators that are being sent. That there is no full disclosure on that front, and that really has brought down the life cycle of concentrators to what it used to be, which is a couple of thousands of hours, to substantially less, to a couple of hundreds of hours, which means that the concentrators that are coming into India now could very well have a very short lifespan and may not even last the entire pandemic. So that's a real serious concern, and we do not even know in terms of functionality whether it really functions as efficiently as the older ones did.
So you pay much more, you're not sure of the quality, there's no guarantee, and it may not even last the pandemic. Mr. Tangen, this is not just unfortunate, this is unethical. Profiting from the pandemic, that's one part. Hiking prices, then putting substandard components in medical equipment is actually playing with lives of people, playing with lives of patients. Are there no quality controls in China?
Not when it comes to the export of these particular items. And let's make it very clear that there's a difference between Chinese government, which has donated 100 standard oxygen concentrators and also 40 respirators, plus $1 million through the Red Cross. From Beijing's point of view, they have been trying to reach across the divide, but they've been rebuffed. A number of times, the vaccines that they're offering, which apparently are fairly good, they're using them on their own people, are not being authorized for emergency use in India. So from their perspective, the private side, who a lot of Indian businesses, hospitals, et cetera, are buying from, they're not, quote, regulated. And it's not just India that has a demand for these. And I think if these people are doing this, it's unscrupulous. It is unconscionable. But you can understand that supply and demand works, and the Chinese government does not have the ability to go in and say nothing can be exported unless you, do these things and those things. This is an instant pandemic. You see this with PPE early on. There were a lot of unscrupulous people who were trying to take advantage of them, not only in China, but around the world, who are trying to literally profit off the misery of others.
Okay.
I think it's very
Dr.
serious,
Malik,
and
it indeed is.
It should be. Let me finish, please. It should be something that the Indian government takes up very serious with the Chinese governments and insists that there should be some sort of export control to make sure that these private companies aren't trying to privateer and do untoward things towards the Indian people. This is a time of crisis. We need to come together, not allow these people to take advantage.
Dr. Ravi Malik, you're a doctor. The quality of compressors, for example, in Geeta Mohan's report, it says instead of hospital-grade equipment, they're using home-grade equipment. Could this then end up being the difference between life and death of a patient at a hospital or perhaps even at their homes?
Gaurav, this is a very disturbing story to me because the life of a COVID patient is dependent upon certain equipments, may it be oxygen concentrators or ventilators or CPAP or BiPAP machines. So we cannot expect them to be of any kind of substandard equipments because we need to have properly made out with according to the scientific specifications. And I must tell you, the life of the patient is dependent upon these concentrators. And there are 4 factors which needs to be seen because someone, if he comes on to cutting the cost, he can cut at many corners. Number 1, what is the flow rate? It should be at least 10 liters. Number 2, what is the concentration of the oxygen? It should be at least 93%. What is the pressure at which the oxygen is being outputted? That must be at least 40 to 70 pascals of pressure. And there should be a high quality alarm which can, hoot off in case the machine is not functioning well. I must categorically tell you, it is not only unethical, it is not only wrong, it is also in fact criminal. Yes. Playing with the lives of the patients who are dependent upon oxygen. Now, God forbidden, if these kind of low quality concentrators, they stop working in the midnight. where the patient will go. He's already dependent on the oxygen being delivered by the concentrator.
Yes.
So it is of paramount importance. And moreover, I must extend my opinion not only to the concentrators, but also to the ventilators or so many other expensive equipments like multi-para monitors and all, which we are getting from China. The life of the patient is dependent upon only two things in the ICU: the competence of the doctor and the quality of the equipment. And the equipment is the only guiding force,
Yes.
which is telling us in what way we have to take our clinical decisions.
And Professor
if the
Brahmachalani,
equipments are of substandard, then
absolutely,
it is.
It's scary. It's scary to think of the kind of equipment that's coming in from China. But Professor Chilani, China was criticized by Europe for sending substandard equipment in the first wave of the pandemic. It seems profits were so huge that China doesn't apparently care about its reputation. It continues to risk lives of people across the globe.
Well, there are several issues here. First is the price gouging, the effort to exploit the spike in coronavirus cases in India. Second is the substandard quality of the exports coming from manufacturers in China. When similar things happened last year, and a lot of European countries raised objections to the imports they had received from China, then China set in motion quality control on export of medical equipment and medical stuff to other countries. That effort on the part of the Chinese government is missing vis-a-vis exports to India. This is the least the Chinese government can do. But look at the bigger issue. If any other country had let a lethal virus escape from its territory and create global havoc, that country would have been in the international doghouse.
Yes.
But China has not just escaped scot-free. It has gained the most from the pandemic. The COVID is still ravaging important economies, but China's exports continue to surge. China continues to rake in a record trade surplus. China is also probably the country that is least affected by the virus. It is a mystery as to how China has managed to stay essentially unaffected by COVID, even as all of China's neighbors, from South Korea and Japan to Southeast Asia and South Asia, all these regions are affected by COVID, but China remains largely unaffected by COVID. It's a mystery.
Mr.
We would like
Tangen,
to know what's the secret as to
would you
how
like to-
China is able to stay essentially unaffected by COVID.
Mr. Tangen, would you like to shed some light on this? Because when the
Certainly.
vaccine that you talk about, sir, reports that seem to come from overseas seem to indicate rather limited efficacy, 50% in some instances, less than 50% in others.
Well, you seem woefully uninformed. The WTO and WHO and other studies have indicated that the COVAX is actually, not COVAX, Sinovac is actually around 95% effective. Now, in terms of my colleagues wondering about the mystery of this, that's part of the problem. Obviously, in India, they don't know what China did. So let me tell you, it was not only that they closed things down and they were criticized roundly. I remember being on various shows on India TV where they said this was a monumental human rights fiasco, taking people's ability to walk around freely. But they did that for 3 months. They got control of it. But most importantly, for the Chinese government, they instituted a system where they can track everybody. Now, you might not like that from a human rights point of view, privacy. But that is why they have been able to successfully do it. Anytime somebody comes down with the virus, they're able to literally know exactly where that person was and who they were in contact with since the beginning of the time. So they're able to go to those people, and I've had friends who've just been told, you have to stay in your house for the next 2 weeks. You have to have tests. Somebody will show up. I mean, I'm a foreigner in China. I was shocked. I was told by my housing unit to go to a certain place. I went there. I received the vaccine. I said, where do I pay? They said, no, you don't pay. It's free because this is a public health issue. So that's why China has done well from this.
So
And it's not
done
a
well
question
for
of
itself,
trying
but lack of accountability remains a cause for grave concern. And this appears to have
What
emboldened.
accountability?
There is lack of accountability in terms of equipment that's coming out to other countries, like Professor
Yes,
Brahmacharani
when
was
you- when
pointing
you
out.
st- when-
Professor
when you
Brahmacharani
start
pointed out
dealing with
the
private
origin,
when you
the
start
origin of the
dealing-
virus was from Wuhan. That is what is being suspected. Millions suffered. China
Suspected,
continues to
yes.
brazen it out, sir.
And it's suspected that India has a triple, variant. But the point is, it doesn't matter where the virus comes from. There's going to be more viruses. Are you going to lay blame if it came from Vietnam or the United States? How about the H1V, avian flu? You had swine flu. These are coming from other places.
So
the
China,
issue, sir, is that
Professor,
what do you do in India? The issue, as in China and everywhere else, is when you have a pandemic, what is the government prepared to do to take care of it?
That's convenient,
has
but
done
Professor
very well.
Chilani, before I bring in our other guests, you may have done it well, but you kept quiet when people traveled. China kept quiet, sir, when people traveled from Wuhan across the world, and thousands of lives were lost.
That is a complete,
Professor Brahmacharani.
that was a complete lie. Now, if you look at the U.S., all right, the variant that went there was from Europe, not from China.
How did
There are
it
only
get
a
to
few
Europe?
cases.
How did it get to
How did it
Europe?
get to
but
Europe?
let me get Professor Brahmacharani to respond to that, Professor Chilani.
Well, what's happening now is that China is using its dominance in the pharmaceutical sector for strategic ends. In fact, it's even seeking to weaponize its dominance in global medical supplies, including in the supply of APIs, which are the raw materials for medicines, vitamins, and vaccines. It's using that monopoly vis-a-vis India now in a very apparent manner. First, not many people realize that India has refused to take any official assistance from China during its current coronavirus spike. When Wuhan was suffering from a severe pandemic, India rushed 15 tons of medical supplies to Wuhan in February 2020. But India has declined to reciprocally take any assistance from China, official assistance from China. What India is seeking and what India is doing is importing medical supplies from Chinese manufacturers. And unfortunately, India's pressing needs are being utilized by Chinese manufacturers to engage in price gouging and worse, as we have been hearing, in supplying substandard quality stuff, which is playing with the lives of people in India. So India is facing a double whammy at the moment. It's paying through its nose and getting substandard quality stuff that is putting at risk Indian lives.
And Dr. Ravi Malik, hospitals, it seems, are risking their reputation and patients their lives if hospitals, perhaps to save some money, or individuals to save money, end up buying this substandard Chinese equipment. I mean, look at the images that we are putting out on our television screen. A coil in that compressor missing and a pipe put instead. Casing which is meant to be medical grade, that's missing and replaced by standard grade equipment. What does this translate into when it comes to the safety of a patient in a hospital, sir?
Gaurav, it is terrible and it is very scary. And it is going to weaken our fight against the curative fight against the corona. I must tell you, there are two fights against the corona. One is the preventive fight, which is dependent upon the vaccinations. And it is the curative fight which is dependent upon the equipment. So if we are provided with substandard kind of equipments, they are going to play with the lives of the people. And now we should have zero tolerance for these kind of equipments. And there should be, and I must request the Chinese government also to take strict action against these people, those who are giving us or those who are exporting these kind of substandard equipments. Because in the ICUs, poor patients are dependent upon these equipments. Imagine a patient is on ventilator. Even the ventilators we are getting from China, many ventilators, many CPAP machines, For that matter, Gaurav, even even a substandard pulse oximeter can misguide a person to death. Supposingly a patient is dependent upon a pulse oximeter at home, and that is Chinese and that is of substandard. And look, if it is showing a normal reading throughout and patient is getting hypoxia, the patient may die. The patient may get confused when to go to the hospital, when not to go to this thing. On one side, we professionals are grappling with this situation.
Yes.
And on the other side, if we are provided with such kind of an equipment, it is really disgusting. And I will bulldoze my opinion that it is in fact criminal. And
It
strict
indeed
action
is.
should
And
be
Mr.
taken
Tangen,
against these kind of exporters.
Mr. Tangen, you know, it just defies logic. China can keep an eye on every individual. They have that kind of equipment. But they can't keep an eye on people manufacturing and selling substandard medical equipment to India and to other countries in the world.
Wonderful question. Yeah.
Yes. So the whole point is that you always think that somehow the Chinese government has control over every single company that's there. Does India have control over every company that has put out substandard products?
A democracy and a country that's not a democracy.
The issue, no, as my colleague said, he said, India has chosen not to accept any help from the Chinese government. Instead, they went to the private sector, where during a time of increased demand, where people are seeing dollar signs instead of seeing compassion, yes, they are taking advantage of the situation. But it would seem more logical to accept the help of the Chinese government, who would ensure that anything that they're sending is, of course, of the appropriate grade. So this idea that you turn down help and then you seek an alternative which is not reliable and then complain that it's not reliable, this seems indicative of a failed approach by the Indian government, which has put its people at risk. Blaming China will not change that.
On the contrary.
And in terms of, you talked about, my other colleague talked about this issue about having preventative, having the vaccines. China has offered them. India has refused. That is the right. It's a sovereign nation. But you put your people at risk when you put politics
China's put people across the world at risk by keeping quiet about the spread of the virus initially. And of course, there are other sins.
There are 11 days. India declared victory against COVID-19.
Well, India will fight. India is fighting, but Professor
you have
Chilani,
massive demonstrations. You allowed all sorts of things to happen.
This dependence on China. This dependence on China. No, Mr. Tangen, I take your point entirely. I take your point entirely. I take your point entirely. But China's silence, and China cannot be forgiven for that silence when the virus spread from Wuhan. It hasn't been brought to account, unfortunately, even by the World Health Organization that many call, that Professor Chilani calls the Wuhan Health Organization. But Professor Chilani,
still investigating the origin.
It needs to be investigated in the right earnest. What was happening in Wuhan? What was happening at the Wuhan lab?
I suspect that you beat your mother. How would you respond to that?
Oh, I mean, that may be a great argument academically, but when thousands and thousands of lives have been lost, it's for China to come clean. But Professor Chilani, this dependence on China is a cause for very, very serious concern, from raw material of medicines to medical equipment and an alternate supply chain. Is the need of the hour. This pandemic perhaps is the biggest lesson of the pandemic, is don't rely on China. And what do you make of government's decision not to take vaccines from China?
Well, first, speaking more broadly, the pandemic since last year has been a wake-up call for the world to move away from dependence on China. China's lengthening shadow over global supply chains comes with enormous risks, and many countries have learned the lesson the hard way, that they need to loosen or end China's grip on global supply networks. And many countries are working toward that objective. Even the Quad has decided to help develop resilient supply chains, and that really means ending China's dominance on medical supplies and other essentials. As far as vaccines are concerned, The fact is that the Chinese vaccines, if you look at the studies that have been done, there was a study done by the University of Peru, which found that the CoronaVac, the main vaccine that China has been exporting, its efficacy is only about 50%. After first dose, it was found that the efficacy is only 11%, and after the second dose, 2 weeks after the second dose, the efficacy is about 50%. That makes it one of the least efficacious of all available vaccines in the world.
Yes.
India is looking for reliable vaccines. If the Chinese were offering a good, effective vaccine, India would have taken that vaccine. But the CoronaVac is certainly not a vaccine that India should be taking, because at a time when India is facing a huge coronavirus spike, it needs good medicines, it needs good vaccines, and it needs all the preventive measures in place to prevent this spike from wreaking more havoc on the population.
Okay.
Fortunately now, the Indian caseloads are beginning to plateau, and maybe the situation is now going to improve in the days to come. That's the hope, but it looks as if this particular surge is finally going to end.
Well, sincerely
Because the
hope
surge
so.
has been-
Mr. Tangan, for the moment, many thanks for joining me. Dr. Malik, many thanks.